Surgery, Michigan. So I have a 32-year-old patient. She had implants done just 2 years ago in 2021, February of 21. Now she has all these quote HLA-B27, which is a marker for ankylosing spondylitis, the many signs and symptoms of rheumatological problems, which is the hallmark feature of breast implant illness. So she's obviously very much hurting, and she just had them for 2 years, a little bit over 2 years, and she wants the implants removed. The pain and misery that she's basically going through. So she had a grade 3 contracture on the right and also on the left, very hard, firm implants. They were not necessarily causing her pain at rest, otherwise that would be a grade 4 capsular contracture. And so she had a grade 3 where she had a distortion of the chest wall plus firm, hard implants. As you can see right here, look at how this implant is. It's basically just 2 years old, 26 months to be exact. And you can see how nice and round and elevated this is. This is like compressed on itself as opposed to this being flat, and you can see the contracture. So I cut out the excess skin, as you can see right here, along with the scar. This really helps with the contouring, especially on the side. I removed some of the tissue, as you can see right here. It just did not look right. You can see some of this bubbles, if you will. That again is the subcutaneous tissue, scar tissue that's in the proximity of the capsule. So the entire implant capsule was removed, and this is exactly how it was sitting. And so what I'm going to do now is I'm going to go ahead and cut this open. Obviously, the fact that these are very firm and hard, let's see what it's going to show us. She was very unhappy with how her whole chest was, the pain that she was having when she would move. So very hard, firm implant sitting on the chest. Otherwise, you know, she has these major hallmark features of what is the rheumatological joint problems. So she was seen by a rheumatologist. The rheumatologist said that you don't have lupus or you don't have any rheumatoid arthritis. So let me go in here. You can see all of this tissue is bad, right? I don't want to leave this behind and someone is very keen or no. You have to remove all of this tissue around that capsule that's inflamed, because this is part of the problem. This is where the leaching is occurring. So as I go in, so look, as I go in right here, see, look how hard that is. And I'm going to go ahead and put it here so you can see. So these are nice scissors. You can hear me cut through this. Very unlikely that the implant is ruptured because it's just 2 years old, but you can see how hard that capsule is. Look again, you can hear it. Now look at the implant, how it's squished, compressed on itself. You can see the trauma in itself, how it's supposed to be kind of more on the flat. You can see this is your Allergan 520cc is nice sized implant. I just want to preserve this so that I remove. You can see how the implant was suffocated. So I'm going to go ahead and show you. You see how this is kind of bunched up on itself. Now, after all these years, it's got a chance to kind of open up, if you will. So as I press, now this is also very important. Look at this fluid around. None of this fell. So if I go like this, this is that gel bleed that's occurring. You can see it has a yellow consistency to it. Very small amount that cannot be sent. So all of this was here. It doesn't take much to cut into this capsule, right? If it cut, then it's not an en bloc anymore. Everything was contained, and again, very thin capsule. It was done very carefully, such that the entire implant capsule was removed. There is nothing out of the ordinary that was seen. Look, some areas so thick, some areas so thin. So look at these kind of mustard type of a color you can see right here, right? Like, so the pathologist will weigh in and we'll see. Look at these. There are some small pecks. We'll see what the pathologist shows.
I'm going to send this along with this. This is just the skin at the surface. I'm going to put this back. In the meantime, you can focus on, the con procedure. This is the essence of what I would say is explant. Look, this is a patient, despite a 520, she's 32 only. 520 cc's. From it looks on the OR table at least, and given her age, she has elasticity of her skin. She's going to recoil along with the breast tissue elasticity. No lift. I feel comfortable with that. No need for drains. The blood loss was 5 cc's or less, maybe 3 cc's on each side on her. I give the pictures and videos if the patient wants of the surgery itself. The capsules are sent to pathology 100% of the time. Cultures sent to microbiology for aerobic, anaerobic, and fungal. Implants always return to the patient. Toilet anesthesia, which is very safe, effective, and comfortable for the patient. And all patients get the same surgery regardless of their age, comorbidity. If someone has, for example, a medical problem like diabetes or Crohn's disease, she gets the same surgery as the patient who is otherwise healthy. So as you can see, relatively softer. It's not raised like a ball. Again, 2-year-old set of implants. And I'm very happy with how the whole dissection went. So as you can see, I go in right here. This one's easier because it's not as thick. So many people ask me, which one is easier? This side with the thicker capsule? I say always the thicker capsule because I have something firm or hard to dissect against. Bad for the patient, good for the surgeon. So as I remove this, you will see this is your 520 Allergan, and look at this fluid that's around. See, if I go like this, see that stickiness? That's your gel bleed that's occurring even despite what is a intact 26-month-old Allergan implant, smooth. And again, as you will see right here, some areas so thin you can see my green glove, some areas thick, some areas. So the goal is to go slow, remove the entirety of the implant capsule, and there you have it. So implants always return to the patient. Capsule sent to pathology. Cultures for microbiology. Toilet anesthesia, no lift, no drains. Pictures and videos, not only of me cutting open this, but also the chest wall, most importantly, showing complete removal of the whole implant caps. And everyone gets the same quality surgery regardless of their age and the other illnesses. And so there you have it. Toilet anesthesia, certainly also very safe and effective. This is Dr. Khan, Executive Plastic Surgery. Implants are not safe. Look, this 32-year-old lady was very much negatively affected by the implants. We will hear from her hopefully very soon how she's going to bounce back. Minus these large implants which were only hurting her. The silicone toxicity, you saw the leaching of the silicone into the periphery. A complete removal of the entire implant, capsule, and block fat. I'm very happy and content with the minimal blood loss, like 3 cc's each side. And there you have it. This is Dr. Khan, Executive Plastic Surgery.